So today we're going to do the physical examination of the chinchilla. These guys can be a little bit challenging to handle for the examination. They want to have their feet solid, but they often like to be up closer to your body than some of the other animals are. And so often it helps to have someone to hold the animal for you. Sometimes you may have to use a towel in order to get some of your examination. If the animal becomes a little bit warm in that towel, because these guys overheat very easily, then you're going to want to take breaks in between your sections of your exam. So just like with any other physical examination, you want to be thorough about how you're going to go about it. And for me, I start at the tip of the body and work my way back caudally and look at all the organ systems in between. And so for starting with looking at him, we want to first start to look at the symmetry of the face to see whether or not we have any ocular or nasal discharge, and also how the vibrissae are moving and if they're moving symmetrically and being held symmetrically. So one of the things that I do in this position is I would start to gently palpate the ventral mandibles on them. These guys very commonly get dental disease, and sometimes one of the early signs of that will be feeling asymmetry to the mandibles on the underside. At the same time, if I can, I want to try to gently palpate the zygomatic arches, and then also around the cheeks and around the base of the ears, because they do get abscesses around the base of the ears as well. So we want to look at the eyes and look for any evidence of conjunctivitis. And then for vision, these guys do not menace because most rodents don't menace very well. So instead, what we'll try to do is what's called dazzle. If you can shine a bright light to the eye, often they'll blink, letting you know that they've seen that light. So we're going to look in the ears. You want to have a different otoscope cone for each ear to make sure that you don't contaminate if there's disease in one ear and not the other. These guys have very large pinna, and it's quite a large internal diameter to the ear, and makes it quite easy to be able to look down and to be able to see the tympanum. Then we're going to gently come back and try to palpate the submandibular lymph nodes and the prescapulars, and most of the time we can't palpate those. Palpating the axillaries, and then gently coming back and palpating the inguinals, and then the popliteals. That usually can't feel the popliteals in these guys very well unless there's disease there. We'll do the oral examination very last. Then we have to be careful as we're holding them as well, because chinchillas can do what's called fur slip. And if you hold them too tightly during your examination, they can just drop a very large section of their hair coat, and it can take months for that hair coat to grow back in. So you want to try to hold them firmly but gently as much as you can. And then we're going to want to auscultate the chest and the abdomen. And in ausculting the chest in these guys, we want to pay particular attention to the heart and the heart sounds, because cardiac disease is very common in the chinchilla. Murmurs are often very common to auscultate. And so in ausculting these guys, sometimes I will hold them up and just gently place the stethoscope in the appropriate place, and then they'll settle down and I'll give you an opportunity to listen. And you can move your stethoscope to multiple areas to be able to hear all areas of the heart. We're going to then gently try to move up and listen to the lungs. And then I'm going to try to listen to the GI tract. And in general, I want to try to listen dorsally and ventrally on each side, because it'll help me with anatomic location if I hear sounds in one area and not in another. 1 to 2 borborygmi sounds per minute is usually normal for these guys. And then I'm going to want to come around ventrally to try to listen to the cecum as well. Again, you could either hear no sounds, which might be suggestive of gastrointestinal stasis, or you could hear hypermodal sounds that could be associated with enteritis and other GI diseases. So then we're going to try to palpate the abdomen, and I'm going to try to hold him and gently palpate. These guys are very full, and it can be difficult to palpate the organs of the abdomen. In general, I usually can feel the cecum. The stomach can be up underneath the rib cage and sometimes can be difficult to be able to palpate. So what I do want to always palpate are the kidneys. Kidney disease is very common in these guys, so I can gently take 3 fingers and come up on each side, push up, and then I have the right kidney isolated here under my thumb, and I can feel back and forth and feel for smoothness and symmetry to the capsule and the size as well. Likewise, I can do the left side, and then I can compare that size and that shape to the other side. And then we want to come back and palpate the bladder. These guys aren't as prone to urinary calculi as rabbits and guinea pigs, but they do sometimes occur. So you want to make sure and palpate that. Then we're going to want to turn the chinchilla over and look at the bottom of the feet. The bottom of the feet, these guys don't have hair on the bottom of their feet. They have pads, and they can get pododermatitis. It's very commonly associated with obesity, arthritis, or other illnesses or ailments that may preclude them from moving around a lot. It could be a sign of something in the husbandry that we would want to evaluate. And while we have them upside down, we want to take a look at the anus and also at the penis in this male. This is a really common place to get fur rings in these guys. So anytime you do a physical on a chinchilla, make sure and evaluate the penis carefully for fur rings. Evaluating the hair coat in the chinchilla is a lot more challenging than it is in some other animals because it is so incredibly dense. However, they still can get ectoparasites. We don't see them as commonly as in some of our other rodents. And so you try to go through it just as carefully as you can to be able to see if you can see any changes. Obviously, any patchy areas of alopecia, if the animal is showing evidence of pruritus, or if you can see any excoriations, should be investigated further. The last part of the physical examination is to evaluate the dentition, and this is extraordinarily important in these guys because they are very prone to dental disease. It's easy enough for us to evaluate the incisors of the animal without having to stress them too much to be able to see them. And in his case, they appear appropriate and aligned correctly. But we do want to look at the premolars and the molars. And that can be a little bit more challenging in these guys, just because they're very stressful. You can attempt to utilize an otoscopic cone, but with the diameter of the otoscopic cone, you're going to get a very narrow field of vision, and you may miss lesions because of it. Alternatively, you can use a nasal speculum or a vaginal speculum, and that helps you to be able to push the buccal mucosa out of the way to be able to see the quadrants of the teeth. We have to put them in a towel for this, and we want to be able to do it as quickly as possible to minimize the stress. But I'll gently lift up the lips, and with the speculum closed, go in sideways, push back against the buccal mucosa, and gently open it. And then when I get ready to bring it out, I keep it open as I bring it out so that I don't grab any of the buccal mucosa and pinch them as it comes out. So taking the temperature on these guys can be done. We use flexible thermometers to do that, we want to check their temperatures carefully. These guys are very prone to heat stroke, and even just traveling to your clinic, especially on a warm day, may overheat them, and we might need to give them a little bit of a break before we go through for a physical examination.